And back in the back, we have Rachel, Claudia.
Rachel Joseph, Chief of Staff to the Deputy Mayor for Health and Human Services.
Claudia Lujan in the Office of the Deputy Mayor.
Eva Wagner, Director of Dr. Licensing at Austin.
Victoria Holmes, Communications with Austin.
Great.
Good morning. My name is Carolyn Terry Taylor, and I'm a Program Policy Officer in Austin.
Great. And I do want to encourage the child development providers. There are seats up here. We'd love to have you at the tables. If you want to come forward, there's a few up here, and there's some up here at the front of the table. So we would encourage you to come forward and sit up here. So I want to turn it over to Lee Beers, who is co-chair of the Mayor's State Early Childhood Development Coordinating Council, who is going to give us an official welcome and set the tone for us here for the day. So again, thank you all for being here.
Thank you, Elizabeth. I appreciate that. Good morning, everyone. It's really nice to see you here, so thank you for coming. As Elizabeth said, my name is Lee Beers. I'm actually a community pediatrician, and I'm the medical director of municipal and regional affairs at Children's National Health System. And what brings me here today is I have the privilege of serving with Superintendent Hansel Kang as the co-chair of the Mayor's State Early Childhood Development Coordinating Council. So I'm just really thrilled to welcome all of you to Mayor Bowser's convening on early childhood. It's really a great day when we can come together as partners to think about how we can improve the lives of our youngest residents. I think many of you may be wondering why a pediatrician is here with early childhood providers, but as a pediatrician, I can really attest to the sense of urgency that we must act to enhance our early childhood system. So, without access to the supportive and nurturing adult relationships like those found in all of your centers and in high quality early childhood education, young children exposed to toxic stresses such as persistent poverty and violence are really at risk for a lifetime, actually not just of mental health illness, but also of physical health illness. And so to me, it's really compelling and such an important reason for our partnership together. And that's why I serve on the SEC-DCC, just to make sure that all children have the best start in life. Most of you, I think, are familiar with the SEC-DCC, but just to orient you a little better, the SEC-DCC is a public-private partnership which has a primary purpose of several goals: to improve collaboration and coordination among entities carrying out federally funded and district-funded pre-K and other early childhood programs to improve school readiness, to assist in the planning and development of a comprehensive early childhood education system that serves children ages birth to 8, and to develop recommendations to increase the participation of children in high-quality early childhood programs, to support the implementation of pre-K workforce development programs, and to improve state early learning policies. This mission and vision guides the SEC-DCC's work. Our vision is that all young children and families in the District of Columbia will receive the necessary supports and services from birth to age 8 to be ready to learn and develop successfully. And our mission is to support and advocate for policies and practices to ensure a comprehensive early childhood education and development system for infants, toddlers, and young children by improving collaboration and coordination among agencies and community partners in the District of Columbia in order for all children and families to thrive. Before we move on, I'd actually like to thank the other members of the SEC-DCC. There's many of you here today that are here with us today to stand and be recognized. I know we have a bunch. Thank you. And Hansel? Yep, okay, great. So it was my pleasure to introduce our State Superintendent of Education, Hansel Kang, who will lead us off today.
Good morning, everyone. It's a pleasure to be here in this important convening under the leadership of Mayor Bowser, who will be joining us shortly, Deputy Mayor for Education, Jenny Niles, and Deputy Mayor for Health and Human Services, Brenda Donald. So thanks so much to all of you for being here. We appreciate the incredible support and commitment that this administration has made to early childhood and ensuring that there are pathways to the middle class that are a reality, starting with our youngest residents. And we are so glad to also have representatives from many of our partner agencies here, because we know we could not do this work at OSSE without the partnership of so many others from across the city. So the State Board of Education, the Department of Health, Department of Healthcare Finance, Public Charter School Board, and Councilmember Nadeau's office. Thanks so much for having representatives here. We are proud of DC's accomplishments in the early childhood space. In fact, last month, the nonpartisan National Institute for Early Education Research, or NIEER, at Rutgers University ranked DC first in the nation in funding and access to high-quality pre-kindergarten programming during the 2014-15 school year in its state preschool yearbook. That's something that we can all in this room be proud of. Much of these accolades really belong to those of you here in this room. But as we know, there is much more work to be done to ensure that all children, birth to 5, are accessing high-quality early childhood education programs so that they can enter kindergarten ready to succeed. There are 3 key areas that we are laser focused on as we build out this next phase of our work: quality, affordability, and accessibility. To bring this framework further to life, I want to take a few minutes to share with you a few of the exciting collaborative efforts that we have underway along these 3 areas. First, we know that quality is essential. It is essential that all early care education settings are safe and healthy places where children are able to explore, learn, and grow. Importantly, we must build a knowledgeable, skilled, and competent workforce that is well compensated, supported, and respected for the work that they do, because responsive, nurturing, and consistent relationships between a teacher and a child are essential in helping our young children get strong starts in life. One way of enhancing the quality of early care and education settings is through our implementation of an enhanced quality rating and improvement system. The QRIS supports providers with targeted technical assistance, coaching, and quality incentives, and provides families with the information they need to make informed decisions about their child's early learning experiences. We've recently launched a pilot that includes more than 20 childcare providers as we seek to improve on the work that we already have in the district in this area. Another way we are supporting quality is by designing a comprehensive competency-based professional development system that supports and recognizes the early care and education professionals that are teaching our infants, toddlers, and preschool children every day. We are proud to have the support of the Washington Area Women's Foundation in this initiative. Secondly, early child care programs must also be affordable. The cost of care for many families in the district is challenging, especially high-quality care. We must create innovative models that help address the gaps in costs and revenues for delivering high-quality early care and education, especially for infants and toddlers. Not only have we led the way on universal pre-K in the district, but we've also allowed families at up to 300% of the poverty line access to the subsidy program. This allows more families an ability to afford child care options for their children, and we look forward to continuing these opportunities. And third, programs must be accessible to all of our residents. We must ensure that eligible families have access to subsidized programs and that families have more high-quality programs available to them where they live and work. We are partnering with the Bainham Family Foundation to help create 750 high-quality seats for infants and toddlers over the next 5 years. And we are working to build out forums for parents as consumers to find, research, and compare early care and education options that meet their needs. We are proud of the work that is currently underway, but we don't want to stop there, and that's why we need you. This work can't be done in a silo, and we are committed to building this system together with our advocates, business and philanthropic partners, providers, families, and other government agencies right alongside us. Importantly, we will continue to convene and engage stakeholders like you to ensure that your voices are at the table as we build plans for the future. It's a privilege to be here with all of you today to hear from the voices on the front lines of building our early care and education system in the district. Thank you for being willing to give us your candid feedback and explore solutions together. With that, I'd now like to welcome up here our mayor and incredible leader in this early childhood space, Mayor Muriel Bowser. Thank you for being here.
Well, good morning, everybody. It's great to see you all here, and I am just delighted that we've been able to come together to talk about what's so important to us, and that is that every person in Washington, D.C., I can't see you guys. How about that? Every person in Washington, D.C. has a fair shot of making it in this town. And what everybody knows, you are early childhood professionals and advocates and stakeholders, so you know better than most. But every person in Washington knows that the work that we have to do as a government gets easier if we put children on the right path from the very beginning, right? Right. And you know what else? That's clap worthy. And you know what else? They are willing to make the necessary investments to do that. And so we have to really make the best use of all of the resources that we are putting into our education system. So I know that you had the opportunity, and most of you probably already know each other. I don't know all of you. And so I do hope that we'll get the chance to say hello and to meet and to talk about the things that are important. Where's Dr. Beers? Thank you, Dr. Beers, for welcoming everybody and getting us started on the right foot. Now, I asked the deputy mayors to bring us together today, but not just today. We are going to lay out a pathway forward so that we have a constant channel of communication around how we improve our early childhood system. So to Deputy Mayor Niles, you should all know her. She's the deputy mayor for education, and she leads the education cluster in our city, and Deputy Mayor Brenda Donald, who leads our health and human services cluster for the city. And so they will each have a role to play in how we have this discussion. I started off asking everybody, do we have enough slots? Are they quality slots? Do they fit every age group? And can people afford it? Those are good questions, right? And so how we answer those questions for Washingtonians will help us move forward. I asked them about all the new changes that we made or recent changes that we made, and we get to go all over the country and say that D.C. residents are committed to early childhood education. But what is the impact on the entire system for pre-K and for our early slots? I've also asked the deputy mayors to focus on the pathway for Washington, D.C. So we're about 700,000 people that live here. And in a few, just not too far distant future, in about 20 years, there will be 1 million people that live here. So you know what that means. Who knows? A lot of babies. The funny thing is, we're known for our growth in millennials, single folks that move here. And the thing about single folks is they get married and they have kids. And they want to stay here. And that's the difference. There was a time in Washington, D.C. When we saw people fleeing our public schools, fleeing our neighborhoods. And now we offer such a great option for families that people want to stay here. They don't want to spend their lives on 270. They want to stay closer to their work and closer to the activities that they find in the city. So we have to make sure we continue our robust investment in ensuring that families stay here in Washington, D.C. So that is really why we're here, to hear from you how we can continue to make the investments in our early child care programs so that they are high quality, that they are dispersed around the city, that they are meeting every age group, and that we're looking for all the ways that the government can be involved with you to make sure that those programs are affordable. And so it is an issue that cuts across every background, income level, and geography, that people want to make sure they have quality programs for their kids. So I can meet a couple that both of them have six-figure incomes, and they're struggling with decisions about childcare. I can meet a family who is struggling and working and striving to get off of the temporary assistance for needy families, and they're struggling with questions about childcare. I can meet somebody right in the middle who has to pay a big mortgage, who has to pay for transportation, who is looking for a quality school for their 7-year-old, and they're struggling about decisions about childcare for their infant. So this is an issue that cuts across all of the city. And so I want to thank you for your commitment to helping us work on solutions, and I look forward to what we learn from this convening. Have a great day.
Thank you so much, Mayor Bowser, for those inspiring words. I'm now excited to bring up Assistant Superintendent for Early Learning from OSSI, Elizabeth Kraginski, who's going to moderate a panel discussion that includes a parent advocate and an early care provider. We're so excited to hear from these great folks on this panel and then open it up for a whole group of discussion after that.
Thank you, Hansel. So I would like to bring up our panelists, Danielle Creek. I need the microphone. Okay. Okay, Danielle Creek, who is a parent at Big Mama's Childcare Center. Lanita Law Reed, owner and director of Kids R Us Learning Center, and Hai-Suk Chung, executive director of DC Action for Children. So will they need microphones? Okay. We're going to project our voices today. So Danielle Creek is a native Washingtonian who is raising her 2 sons, Raheem 7 and Amir 2, here in D.C. Amir attends Big Mama's Child Development Center in Ward 8. Danielle graduated from Eastern High School, completed her undergraduate at Washington Trinity, her master's degree at George Washington, and has her last 2 classes of law school at UDC. So she is truly a Washingtonian. Yes. Great. Lanita Law Reed is owner and director of Kids R Us Learning Center 2, a licensed and nationally accredited early learning program for children ages 6 weeks through 5 years old, also in Ward 8. Lanita is also a native Washingtonian who has dedicated her career to educating and strengthening the lives of young children, their families, and her community. Lanita began working with children as a teenager and has enjoyed teaching and working with children and families for over 20 years. She holds a master's degree in early childhood education from UDC. Hai-Suk Chung is, yes. Hai-Suk Chung is Executive Director of DC Action for Children, and Hai-Suk has worked to improve the lives of children through direct service, program management, philanthropy, and advocacy for the past 19 years. She has consulted for and advised the Washington Area Women's Foundation to support the Early Care and Education Funders Collaborative and the D.C. State Board of Education. In addition, Ms. Chung has worked with the Head Start Quality Improvement Center and the Early Head Start Resource Center, providing technical assistance and consultation to early Head Start programs throughout the country. So thank you. Wonderful. So my first question is for Danielle. In 2015, the District of Columbia invested approximately $90 million in our subsidized child care system to support the care of more than 12,000 children. As a parent who has used the child care subsidy system in the past, describe for us your experience, and in particular, what worked well and what challenges did you encounter as a parent?
Okay, so for my 7-year-old son, I used the subsidy system because I was going back to school and starting over working part-time with him. And so I would say that the ease of the process was that I knew that I wanted to go to Big Mama's because I've had a history of knowing the family that runs and owns Big Mama's, so I knew the level of care that he would get, and I knew how I felt comfortable with him being there all day long. I would say some of the challenges would be the process of the subsidy program, the process of going down to the building on South Capitol Street and going through the voucher process, and it's almost very monotonous, like robotic. You just go, and there's no human care or no care for the fact that you have children and you need this subsidy, and you are actually a person who is going through something, but this is not defining who you are. You know, this is just a temporary step for some of us to get to where we need to be, and there's no there's just no understanding or no human compassion for that. And I think the challenges was just, going through that process. The paperwork is very strict and very strict and very stringent, and it's just, I don't know, all of us aren't abusing the system. Some of us actually need the help, and it would be nice to actually be treated like, hey, I am a person too that live in the city. I just need these services and not just the random, coming through trying to take advantage of something. I think that was the only challenge, was just getting the system to recognize that I need, that you need the help and that you want to be supported so that you can move forward and not be dependent on the system.
That's right. Thank you. Lanita, OSSI licenses nearly 500 child development centers across the city, 350 centers and 125 homes. In addition, we administer almost $8 million to high-quality centers that provide the enhanced pre-K programming for 3- and 4-year-old children. Please share with us your experience as a licensed pre-K enhancement child care subsidy provider. Again, what is working well and what challenges have you had in administering the multiple funding streams or other challenges you've had?
Well, we are very happy and excited to be a new participant with the pre-K expansion and enhancement and expansion program. I think the biggest piece that we welcomed was the opportunity to legitimately compete as a community-based organization with our counterparts such as DCPS and charter schools. We in our community have always known that we have provided quality care, nurturing experiences, helped our children, not only our children, but our families be successful. But the opportunity to offer that to families at no cost is so significant because for many families, they do understand quality, but the decision comes down to, do I pay or do I not pay, due to whatever their financial family circumstances are. So having that opportunity to legitimately compete allows us and affords our families the peace that their child can remain in a high quality program that perhaps they've been with these teachers and caregivers since they were 6 weeks old, many of them. So that is definitely exciting, and I think one of the challenges is ensuring the quality and retaining our high quality teaching staff because of the competition and because many other government programs are able to provide other benefits, additional opportunities and things that we may not have the luxury to provide. That is an ongoing challenge to retain those highly credentials and qualified individuals. And I think that's probably our biggest challenge. We need to continue to allow our other teaching staff the opportunity and the exposure to higher education so that we can continue to help them grow and become credentialed and receive their degrees within the program as well.
Thank you. Hi, so as the mayor mentioned, we have lots of babies in the District of Columbia. Each year, in fact, 9,000 babies are born in the district. A recent report that your organization did indicated that the birth-to-5 population has grown by 25% in the district. And in a report that OSSI released in March of 2016, the cost estimation model, we found that quality infant and toddler care is the most expensive care to provide. What challenges and opportunities do you see for the district in addressing these issues?
Yes, that's a great question, and I think given that we're framing this conversation in a continuum of services for 0 to 5, the 0 to 3 population is going to be very important. In fact, I looked at the numbers yesterday in preparation. The under 3 population grew by 34% since 2005, and so it's going to continue to grow. It is the fastest growing population in the city. So when I think about how the city, especially the deputy mayors and the mayor thinks about the continuum of services, and especially with the cost modeling, one of the things that we have really struggled with is trying to figure out the baseline of data needed to really address this question of quality, this question of accessibility. And we have the basic metrics about enrollment, around age group, and very numerical. focused data points, but we have not really had a continuous cohort of information to really see how our investments in pre-K and see our quality investments are really improving the lives of children. So that's one area that I would focus on. The other is that through this cost modeling, one of the things that we're having to define as a city is, what is quality? I think quality and accessibility and capacity. I think as a number and this population of 0 to 3 is growing, how do we ensure we maintain not only the quality staff that small organizations and small community-based organizations are training and maintaining, but then how do we incentivize programs to really work on a comprehensive model, not only incentives for the programs, but incentives for the professional to stay at the community-based level.
Great. Well, we now want to turn to you for your suggestions. Turn first to Danielle. If you could change one or two things about the early care and education system in the district to make it more parent-focused, what would those changes be?
I think two changes that really come to mind that I think would help me, and one of them, or the primary one, would be the access to the child care for those of us that I like to call the working poor, that aren't quite at the poverty line, that's on the list that they say if you qualify for benefits or not. But then we also aren't, the rich and wealthy as well, and access for those of us like that who don't qualify for a voucher, but really are struggling to make ends meet every day. You struggle with, do I pay $300 plus a week for child care, or do I, keep my child with me and just stay home all day? And that's a serious contemplation that a lot of parents like myself have. It almost makes you want to quit work just to get a voucher so that you can send your kids to child care affordably. But then that defeats the whole purpose, because you want to move forward and you want to get going. So having that path or that access for those of us that aren't at the poverty line that's listed for benefits, but also are moving forward but still need that help in the middle. And I don't know if that's just like another chart of guidelines for those of us that are in the next step, maybe step-wise the guidelines or the qualifications may need to be. And then the other one would be the family involvement, or the family parent inclusion involvement at the child care center. I was recently put on the parent advisory board for the child care center, and it's the difficult part is getting parents involved in the very basic parts of it, just knowing what your child is doing in classroom, and knowing that they need more Pampers, and knowing that they need to change your clothes, and being active in that part of it. Not to mention going on field trips and doing other extra things, but it's just the day-to-day child care. Parents need to be involved in it. It's not just to drop your kids off and we'll watch them and then you come back and get them. Because, and I found with my older son that when you're involved in that entire process, it makes a big difference, because all the child wants to know is that they are accepted and appreciated by everybody. So if they see mom there at school doing the same thing and following up at home, and the process continues, and it makes, I think, a big difference in the behavior and the social emotional growth of the child as well. And it's finding ways to reach out to those parents that to show them that being involved in your child's child care will help them in the future. And I don't know how we can get that through to the parents, but I think that's a big piece of it, and I think that'll help with the direction, the quality of the child care that's offered.
Thank you. Lenita, similar for you, if you could change one or two things about the child care licensing subsidy pre-K to make it more supportive for providers, what would those changes be?
Two? No. So I think what comes to mind initially is having the supports to employ tools such as the accreditation tool that we use, which was NACE accreditation, National Association for the Education of Young Children, and there are other accrediting bodies. But I know that using that tool within my program, it required that all of the stakeholders were involved. That means our program staff, teachers, everyone that works in the program, our families, our stakeholders, and our community as well. So knowing that we all have to work together and evaluating our program, our strengths, our challenges, and having a plan to move forward so that we can ensure that for all of our children and our families, we're providing high quality care. I believe having the supports to be able to use that tool within your program and to maintain the quality within the program is so critical. It's just a very emotionally draining, it's very financially draining to go through such a process, and especially when your program has continued to become and maintain their accreditation. You know, as the years progress, you have to renew and reevaluate. So that is definitely challenging. So many supports in that area would be ideal, so that those programs who do have the financial challenges and are trying to employ high quality people who are dedicated and committed will be able to do that and remain a high quality program. I think just the piece to support programs who are trying to maintain our teaching staff. I think that is the other big important piece. As I said earlier, it's the challenge to retain these highly qualified individuals. It's just a challenge for programs, so we need a lot of support and resources, professional development opportunities for other individuals who want to enhance their skills and obtain a degree. Things like the HDC program is awesome, so ensuring that is something that where teachers receive financial assistance to go through school and complete their AA or their bachelor's degree is very important. So continuing programs and adding more programs like that, I think would also benefit our children and our families.
Yeah, similar question. Well, I guess too, I think one of the things that we should applaud ourselves for is just because of the need, DC's been very creative pulling down resources from the federal side. And just like the cost model report that came out, I think now that we have a baseline of the true cost of, the expensive cost of caring for infants and toddlers, I think one of the things that we're learning from the other evaluation, other creative project being launched right now in DC is this Childcare Early Head Start partnership, where we're learning that shared services, shared overhead could be a practice and a model that we move towards. And this is the notion where a larger agency is building the capacity of smaller community-based agencies as a hub model and really lifting general operating systems and other things that everybody can share. Like just the notion of having a pool of substitutes. You know, when you're a very small shop, how do you get access when you're sick and you can't come? But if you have a pool of 10 programs working together, that could be something feasible. Another thing I think from both the cost model and the Quinn, the Quality Improvement Network work that we're seeing is, again, professional development and just the whole notion of building the pool. I think one of the things that I applaud the mayor doing is seeing the infants as a resource for the future in DC. As our population grows, this is an interest area and a population we have to invest in. There are future students, there are future nurses, there are future, and so as we think about quality, we have to think about the big gap in the need of professionals in this space. I think, we're very interested in talking a lot about how to think about creative ways to incentivize programs, retain staff, but one of the next things we need to do is there is a huge gap in professionals in this space, and how do we ensure that as our population grows, that so does this workforce.
Well, great, and I really appreciate the candor with which you've shared with us both your challenges, the opportunities that the district provides for young children and for providers and families, but as well as the focus on data, really understanding that, our workforce, and parent engagement are wonderful themes for us to kick off for everybody. So if everyone could join me in thanking this incredible panel. We're excited now to open up to the whole discussion, to the larger group, so you can go back and join your tables. At your tables, you will be given one of our focus topics and a set of questions that we'd like you to explore together. We will take the next 15, 20 minutes for you to discuss these as small groups at each of your tables. We have a focus on children, a focus on our provider community, and a focus on families. Each of those are important constituents in building this early care and education system in the district. Please designate one member of your table to take notes, or you can share it among the table if you feel that that's more the style that you'd like to do. There will be members of the staff, and hopefully the mayor will be able to walk around the room and observe conversations. You can ask us any questions. We really want you to capture your ideas. Okay, go to the mic.